And welcome back. High blood pressure, hypertension, a major risk factor for heart disease. Half of America is suffering from some form of high blood pressure, and many really don't even know why that they have it. That's why it's called the silent killer. Joining us now, Singing River Health System internal medicine physician, Dr. Jack Murray. Dr. Murray, thanks so much for coming in. I mean, the numbers are staggering when it comes to high blood pressure and hypertension.
Most definitely, thank you for having me. Always good to be here. May is High Blood Pressure Awareness Month. It's kind of the quintessential screening ailment, probably one of the first. We always look for something that people don't know they have, that is dangerous, and that we can fix, and high blood pressure checks all that. 108 Americans, adult Americans that is, have high blood pressure, and about half of them probably don't realize it. High blood pressure leads to a lot of scary things that people may or may not realize. I do have a lot of patients that come in and say, oh, my blood pressure is okay, it's not that bad, I don't have any symptoms. And that's the problem. Like you said, it's the silent killer. We want to get to people before they have any problems.
You know, I've noticed that they kind of changed the standard. The old rule used to be 120/80, I think, was kind of the perfect blood pressure. Haven't they adjusted that a little bit in recent years?
They did give us a little leeway. 120/80 is still considered normal, or less than 120/80. But now, to prevent the most severe complications, we want it to be under 140/90. But for my patients, typically, if you've got diabetes, obesity, cholesterol, any other problems, that's just not sufficient. So I tell my patients, I want your blood pressure to be as close to that 120/80 as possible, so that you're not having renal failure and on dialysis, heart attack, stroke, heart failure, blindness, and just a whole bunch of other stuff that can be prevented with high blood pressure treatment.
Yeah.
That we don't want to find
and
out.
high blood pressure treatment, I mean, the medicine they have for high blood pressure is first rate right now. But it's still diet and exercise and lifestyle have a lot to do with blood pressure, right?
There is. So there's some things we can't change. Your parents, so your genetics. There's some things we can change that is easier said than done. So being overweight, and there's some stuff that's relatively easy but still hard to do. Reducing your sodium, reducing alcohol intake, quit smoking, all these things that people pretty much know about. And even some of those, even people who are compliant in all 5 of those issues sometimes still have problems with blood pressure, and that's where medications come in. And the good thing about blood pressure medicines is most of them are tried and true, well tested, very safe, and most importantly, very cheap.
Yeah.
And easy to take. Most of them are once a day now.
And I've noticed the high blood pressure medicine isn't like a lot of other medicines you see advertised on TV where they have a long list of side effects and things. High blood pressure medicine is pretty pure, isn't it?
Pretty safe. There are some people, you'll have an allergic reaction, which you could have
or dizziness.
Or
maybe.
dizziness, and I tell my patients, if you get dizzy, let me know, because that means I've gone too far. But for the most part, there's some minor adverse events, but allergies are what we worry about, but you can have that with shrimp.
Yeah. And very quickly, and we're actually out of time, I don't really like the machines you buy at the stores and do at home by yourself. I always like a nurse to do it. But do you think people should test themselves regularly with machines they can buy and do at home?
If they're worried about their blood pressure, especially if when they come into my office, their blood pressure is always high and they think it's better at home, I tell them to check it at home. But I'll also ask them to bring their machine in to the office so we can make sure it's accurate.
Okay, Dr. Jack Murray over from Singing River. So good to see you, Dr. Murray. Great advice today. Thanks for being with us.
Wonderful.